Hello, and welcome to the December 13th information session about the Opioid Abatement Authority for local governments. My name is Jennifer Nelson, Virginia Institute of Government, Assistant Director for Membership and Engagement. The Virginia Institute of Government is the leadership development and community engagement arm of the Weldon Cooper Center for Public Service at the University of Virginia. Through our research, leadership development programs, and local government engagement initiatives, we continue to work towards our vision of good governance, equity, and resilience in every Virginia community. VIG offers leadership development through SEI and LEAD, local government equity clinics, certification for treasurers and commissioners of the revenue, and customized training programs. State agencies and local governments can access a range of consultation and support services to build more resilient organizations. We have a team of seasoned public sector leaders and subject matter experts ready and available to facilitate Board of Supervisors, city and town councils, leadership teams, strategic planning retreats, and other related events. Today, VIG is glad to partner with the Opioid Abatement Authority for this local government information session. The goals of this presentation are to share what OAA is and to give an understanding of the process moving forward. Please know that at the VACO VML Local Government Day on January 19th, the authority will be the keynote presentation and will hold a grants workshop at the end of the day. The next day, January 20th, OAA will conduct a best practices session from 9 until noon. Now for housekeeping, this session is being recorded and will be posted on the Opioid Abatement Authority's website at a later date. If you have any questions, please type them into the chat, and when we have a break midway through, I will ask them. We will also have time at the end for questions, so please click the raise hand button and I will call on people. Thanks again for taking the time today to join us to learn more about the Opioid Abatement Authority and their work. Now I'm happy to turn things over to the authority's Director of Finance, Adam Rosatelli. Adam?
Thank you, Jennifer. I appreciate that. So I'm going to go ahead and share my screen here. All right. Well, good morning, everyone. Again, my name is Adam Rosatelli, and I'm the Finance Director for the Virginia Opioid Abatement Authority, as Jennifer said. So really appreciate you attending this virtual information session on Virginia's opioid settlements and the authority and the funding that will be provided to localities. I'd also like to express our appreciation to the Virginia Institute of Government, who has facilitated and is hosting this event. So again, thank you for putting together this important information session. So this is the second of the two sessions we've scheduled, the first having taken place last Thursday on the 8th. And there was similarly strong attendance, and we had a lot of great questions. So hopefully we can replicate that success today. So just in terms of the format for the presentation, I'd like to provide some background information on how the opioid settlement funds came to be, their settlement structure and allocation, a little bit about the OAA and the timeline we're operating under with respect to kind of creating the policies, procedures, and infrastructure to begin to develop the grants application process and get the funds out to localities so they can be applied hopefully in a meaningful way. So given that, I'll just go ahead and jump in. So again, a little bit of background on the opioid litigation and settlement. So it really began in 2007 following the guilty pleas of Purdue pharma executives in federal court at Abingdon to criminal charges that they'd misled regulators, doctors, and patients about their drugs, OxyContin's addictive properties and risk for abuse. That was followed by thousands of civil suits against Purdue and various other defendants in the pharmaceutical supply chain. That's primarily the opioid manufacturers and distributors, and then certain management consultancies such as McKinsey, who advised them on those marketing tactics and so forth. And most of those civil suits originated in the Appalachian area of the United States. So West Virginia, Kentucky, Tennessee, and Virginia, and so forth. And those suits included state and local government entities. So several years passed, then in 2017, a federal judicial panel consolidated all of the federal litigation into a single multi-district litigation, or MDL. And legal experts have described this as potentially the most complex civil case in U.S. history. So while there are several settlements that are still in the process of being negotiated, the parties thus far that have that have finalized their agreements, and these would be reflected in the shares, the direct shares that your localities have already received, and the OAA has received some funding as well from these settlements. It's two. One is the pharmaceutical supply chain distributors. That's McKesson, Cardinal Health, and AmerisourceBergen. Those are the largest ones, as well as opioid manufacturer Janssen, which is a subsidiary of Johnson & Johnson. So those are the defendants. So the plaintiffs in these cases are the state's attorneys general and the plaintiffs' lawyers from the MDL representing the political subdivisions. So Virginia's settlements are based on these agreements and negotiated at the national level and entered as a final consent judgment here in Richmond Circuit Court. So with respect to Virginia's participation in these settlements, it includes just the state and its legal subdivisions. So those are the cities and counties. So it doesn't include any individual claims or private interests, and it wouldn't include, for example, a town, which would be considered part of a county. In late 2021 and earlier this year, Virginia's AG's office worked with local attorneys and outside counsel representing localities to encourage cities and counties to participate in the MDL and drop their individual suits. So fortunately, all of the Commonwealth cities and counties joined the MDL, and that really maximized the amount of funding that Virginia was eligible to receive as a result of that. So all these legal documents, both statutory and judicial related to the settlements and the authority, are kind of woven together as the consent judgment. And Circuit Court kind of incorporates all of the documents, the settlement agreements, the state's MOU, and the statutory provisions related to the authority. So this is just a quick look at the code section that establishes the Opioid Abatement Authority and the Opioid Abatement Fund. So essentially, there are three key elements that form Virginia's guidance for opioid settlement fund distribution. And there's the settlement agreements with the defendants. There is Virginia's MOU with cities and counties, and then there's Code of Virginia, Title 2.2, Chapter 22, Article 12, which again establishes the Opioid Abatement Authority. And it's important to point out that if there's a contradictory or conflicting terms and conditions among these documents, settlement agreement and court orders effectuating that agreement will generally control. So this is a quick look at the OAA's board of directors. It's made up of 11 members, 2 representing the money committee chairs or their designees. So presently this is Senator Pillion and Delegate Ballard. And so Senator Pillion is representing the Senate Finance and Appropriations Committee co-chairs, and Delegate Ballard is representing the chair of the House Appropriations Committee. The HHR secretary serves in an ex officio capacity. And then there are 8 gubernatorial appointees, including local officials and various subject matter experts in substance use treatment and recovery services. And looking at who can receive distributions from the OAA, again, I'd mentioned this, but it's only the cities and counties, right? So those are the parties to the legal action, and those are the participating subdivisions that have signed the settlement MOU, as well as state agencies can receive funds. Localities in the state, however, can partner with various organizations to provide services, but are required to adhere to procurement laws and must oversee the work performed by those organizations. So again, I already touched on this, but these are the settlements that are currently being paid to Virginia, and a closer look at that. So other settlements being paid, the distributor settlement will pay a maximum of $21 billion over an 18-year period and requires a minimum percentage of those funds be used for opioid abatement or remediation. And depending on whether a locality was or was not engaged independently in litigation prior to joining the MDL, either 100% or 85% must be used on abatement purposes. Janssen will pay a maximum of $5 billion nationwide over 10 years, and that requires a minimum of 86.5% be spent on abatement, and for all localities, irrespective of whether or not they engaged in litigation prior to joining the MDL. And pursuant to the agreement and consent order, any use of funds for non-remediation must be reported by the locality to the court and to the defendant. So this chart provides an overview of the distribution of funds per the settlement agreement in the MOU. So in total, this represents just over the total settlement award, about $536 million coming to Virginia, again, just between those two, the two settlements that have been finalized. You can see the cities and counties, the direct shares, some of which you've already received locally directly from the settlement administrator is 30%. The Commonwealth share, direct share is 15%, and then the OA share is 55%, which is further subdivided between the localities and state agencies. 15% of that in that lower left-hand bucket you can see is essentially those are local funds and what we kind of call entitlement funds that are distributed based on the same formula that the 30% direct share you all have received is based on, and that's essentially a per capita measure of harm that was done by a third party that's affiliated with UVA, I believe. And essentially, that's looking at the number of opioids that flowed to your localities, to your communities, the number of ER-related opioid visits, and then the number of opioid-related overdose deaths, I believe, make up all the variables that would drive this percentage formula that determines the allocation of the funds that you receive. And then there are some other buckets there under the Opioid Abatement Authority, 35% for regional projects, and that's essentially any collaborative project between 2 or more participating subdivisions. Then 15% is reserved for state agencies. And then there's an unrestricted bucket where the board has a little more discretion on its use. So it could essentially augment any previously approved project under the local or regional or state agency type projects. And then a small portion comes out of that 35% unrestricted bucket to cover the OAA's administrative costs. So I said, again, this all represents right now of the two agreements about $536 million over the course of the 18-year term of the two settlements. But there are other settlements in the pipeline, including drug manufacturers, Purdue, Mallinckrodt, Endo, Teva, for example. And as you probably heard recently, the roughly $13 billion settlement among the 3 largest retail pharmacy chains, Walgreens, CVS, and Walmart. So the total allocation to Virginia could increase to somewhere between $800 million to $1 billion over the term specified in these agreements. Okay, so this graph depicts the estimated payout over the full 18-year period for again, just the 2 settlements that have been finalized, the distributor and Janssen payments. And this is the OAA's funding that would go out, so that those subdivided amounts from the OAA. You can see that spike in FY23. So that's related to because Virginia was able to get such a high percentage of its localities joining the MDL, which again maximized that amount of funding that the Commonwealth was eligible to receive. Janssen is paying 4 years worth of funding up front, or about $39.8 million in the current fiscal year, with the next scheduled payment occurring around FY27. So you can see that there's an advantage to having a high number of the localities join onto the MDL, which reduces the financial liability from the defendant's perspective, right? And puts us in a good posture to kind of maximize the amount of funding and also the forward kind of getting an advance funding of some of those settlement proceeds. And so the rules, and not only are there differences between each settlement, right, but there are differences between the direct shares that are going to the localities in the state, and then the funds that are governed by the OA and distributed by the OA. So for the pharmaceutical distributors in Janssen, all the funds are, the language communicates that they're intended to be used for abatement purposes, and then certain percentages are required to be used for abatement. So that's, again, not only different between the agreements, but also different if you were litigating or non-litigating attorney or locality prior to joining the MDL. And so while the settlement agreement provides some percentage of funding for technically non-abatement purposes, it uses language that says it disfavors that use. Other than for abatement, it must be reported to the settlement administrator, the settling companies, again, to the general public. So they certainly, when these were crafted, they put in a mechanism to clearly discourage the use of funding for non-abatement purposes, right? And then I think it goes without saying that given both the court-ordered and statutory restrictions on fund use, that localities should keep detailed records of how each dollar of settlement money is spent. Okay, see, these are some frequently asked questions regarding the direct allocations from the distributors and Janssen settlements. And then I'd like to point out that on our website, the OAA website, there is a document that the OAG has put together on the key provisions related to use restrictions and what qualifies as an abatement or remediation use of funds. And then I'll mention this again at the end of the presentation, but I figured I should point that out. So looking at some of these FAQs, so can a portion of the funds be spent on non-abatement activities? So again, in some limited cases, although it is disfavored, and then again, it requires notification to the settlement administrator, the companies, and the general public. So again, it's putting in kind of a mechanism to discourage that use, even though it allows for that little bit of kind of a nominal amount to be used for non-abatement purposes. Can the funds be used for the locality to reimburse itself for prior expenses? So again, this isn't clearly defined in the settlement agreement, and surprisingly, there's a lot of there's vagueness around what does and doesn't wasn't applicable in terms of these sorts of things, such as supplanting and so forth. But it could be possible, but it kind of presents a risk to the locality if these terms are more clearly defined at a later date by the court. And so can the funds replace local expenditures or supplant? Again, that's not clearly defined. So same answer as the previous question. It potentially is possible, and it's not explicitly stated in the settlement agreement. And how is the agreement monitored, and what are the record keeping requirements? So again, the agreement is judicially monitored, and then the record keeping requirements may vary by settlement agreement. So not only the purposes, the amounts that must be spent on abatement differ between the settlement agreements, but different specifications and stipulations in the agreements surrounding settlement funds will likely differ as well. Okay, and Jennifer, I think we can take a break. If there are any questions, I'd be happy to answer any that we've got right now.
No questions.
No questions. All right, I'll keep rolling then. All right, so again, the OAA's funds are going to have a much clearer set of rules. So 100% must be spent on abatement efforts, more specifically efforts designed to treat, prevent, or reduce opioid use disorder or the misuse of opioids, or otherwise abate or remediate the opioid epidemic. And all of those, it's not an exhaustive list, but the statute kind of describes all of the treatment, prevention, education, use reduction sort of categories that would qualify for opioid abatement and remediation. And there's quite a bit, the way the language is structured, I feel like there's quite a bit of latitude in how those funds could be applied. But they definitely would have to be for abatement purposes, 100%. So again, where it's unclear or disfavored in the settlement agreement for the OA funds, again, there's no reimbursement of previous costs or supplanting allowed, nor are there indirect charges allowed. In addition, localities are required to report the outcomes related to the funds that are distributed in the projects that they're used for on an annual basis, and then allow it to monitor the programs. However, having said that, the OA doesn't really envision, and it really doesn't have the staff to embark or engage in a robust audit program of local expenditures. Really just here to make sure, to help localities spend the funds for appropriate purposes, for, not only to stay so we're all compliant, because we're all kind of mutually tied to the settlement agreements in the MOU, but just to make sure that we're adhering to our statutory mandate to make sure the funds are spent in an appropriate manner. Okay, so given that the OA's use of funds.
Can I cut in here a second? We do have a question about if you can clarify judicially monitored.
Yeah, that's so the consent, I'll do my best, right? That's kind of vague too. I don't know exactly. It's monitored in that it's a self-reporting mechanism, right? So if you were to use funds for non-abatement purposes, you're supposed to report it, in which case that is the method by which the court would become aware of how you've misspent funds. Other than that, I'm not sure the monitoring would be if it's really kind of unclear. I may have to get back to localities or maybe provide more information during our grants workshop. But it's my understanding that that's really kind of the mechanism where they would find out, right, if there's something that is not consistent with the consent order. So that's that. Again, that's pretty much the best answer I've got. The OAA, again, our oversight responsibilities are much more clearly defined than are in the settlement agreements.
Great, thank you.
Yep, thanks. Okay, so let's see here. Okay, so given that the OA's use of funds are guided not only by Exhibit E of the settlement agreements, which kind of lays out the approved abatement uses, and similarly in state statute, and are clear on these use restrictions, rather than what is implied or suggested in the settlement agreements. We're referring to the OA's rules as kind of the gold standard for managing opioid funds. So if a city or county chooses to apply the OAA standards to all of their distributions, they will always be in compliance with the settlements, even when there are differences between those settlements. So applying, I'd spoken to how there are a lot of differences between the settlement agreements and the amount of the percentages that must be applied specifically for abatement or remediation. So applying a uniform standard, say you were to adopt the gold standard that the OAA that governs the OAA uses of funds, you could apply a uniform standard to how those funds are used and not have to have kind of a bifurcated or split up system for tracking those funds to be consistent with each one of those settlement agreements. And it benefits the entire Commonwealth, again, since we're all bound together in these settlement agreements. And I hadn't really touched on this, but if the defendant, so you report in terms of, I guess, judicially monitoring, right? And it's a kind of a self-reporting system. If say you're going to use something that technically doesn't qualify as abatement and try and do something that is outside of that scope, and then you report that in that little 15% or less amount that's available, the court would know. And if there are enough localities potentially that are doing that, the defendant may go to the court and say, look, these localities aren't necessarily adhering to the terms of the settlement agreement. We would like to petition the court to reevaluate our settlement terms and maybe reduce the amount of money that that Virginia is eligible to receive because people aren't adhering, localities aren't adhering, or maybe the state isn't adhering to what were the terms that were specified in the settlement agreement. So we're all kind of mutually in this sort of arrangement, and it's to all of our benefit that we kind of adhere to the highest standards for the fund use. And then if the funds are used consistent with the OAA standards, the OAA would be in a position to be able to partner with and support localities if any judicial or legal questions arise about their use of funds. All right, so in October, I'll just go ahead and get all this going here. So in October, every chief executive, chief administrator, or manager in each of your respective localities should have all received an email, both an email and a physically mailed letter from our executive director, Tony McDowell, providing information about your settlement payments, as well as an offer to incentivize voluntary participation to apply the gold standard use of funds, again, to both your direct share distributions, as well as those distributed by the OAA, which is illustrated in this graph. So if you were to agree to apply those standards to assure compliance with settlement terms for all of our mutual benefit, again, the OAA would use from its unrestricted discretionary funds amounts to increase your OAA local entitlement funds by 25%. So again, that 15% that you would receive would be increased by 25%. And the letter also specified some steps you should take now to ensure that you're eligible to take advantage of the offer. And that's essentially making sure that the funds and expenditures are accounted for and can be later reported, and that those expenditures are in line with the national settlement agreement at the very least, and that no supplanting or indirect costs have occurred, and preferably you've implemented and begun to maintain some performance measures associated with those expenditures. Okay, just a few more details about the OAA funding. And I think I've touched on most of this, but again, for the 15 of the amounts that are subdivided by the OAA, the 15% reserved amount for cities and counties, again, those are driven by the same formula, that per capita measure of harm, 35% for regional efforts, including 2 or more participating subdivision, 15% for state agencies, and then 35% unrestricted. for previously approved projects. I don't think I mentioned anything new in that slide. So consistent with statute for discretionary funding awards, higher priority will be given to programs or organizations with established records of success. So we're not really looking to reinvent the wheel or anything, right, with most of these. So evidence-based, evidence-informed methods that, you know, maybe are accredited or certified by state or national bodies, maybe the Virginia, you know, a stamp of approval from the Virginia Society of Addiction Medicine, for example, or a DBHDS certified treatment program, for example, would be like an established program with an established record of success. 2, programs in communities with a high incidence of opioid use disorder or opioid death rate relative to population. Programs in a historically economically disadvantaged community. And then those that include a monetary match from the applicant with a higher priority given to an effort with a larger matching amount. And those matching amounts can be composed of your direct shares, right? So that 30%, you've begun to receive payments of the 30% bucket of your direct shares. You can use that to match to receive more funding potentially of this discretionary funding that the OAA will provide for those local and regional projects. We're also in the process of putting together what we refer to as our toolkit for localities to use that may assist in identifying specific programs and service providers in the areas of opioid use treatment, prevention, and reduction that will kind of inform what types of things you might want to do when you're applying for both your kind of OAA entitlement funds and those discretionary funds that we'll distribute. Okay, speaking quickly to coordination. Yes, coordinating among the various stakeholders in order to best maximize the use and effectiveness of the settlement funds. You know, there's really an opportunity to engage in a coordinated effort, including the OA, locality, state agencies, and other service providers and stakeholders that would be based on a statewide mission and local stakeholders driving implementation. In addition, the funds are going to be coordinated with other source of funds to avoid a duplication of efforts. All right, so wrapping up now. So we've been busy here at the OAA the last several months, just building out our small staff. There's just a handful of us here, setting up the office and the administrative infrastructure, again, to get us in a position to begin to distribute these dollars to localities and state entities. So a grants committee has been formed that will review local and state applications for OAA discretionary funds to make recommendations for board approval. There are a number of listening sessions that I think Jennifer may have mentioned, but those listening sessions are also available on our website. But we're holding a number of listening sessions throughout the Commonwealth, which will give an opportunity for stakeholders to express how best to address the opioid epidemic in their communities, and will identify service gaps that also may inform how localities may pursue what programs they may pursue when deploying their OAA funds and their local direct shares. So the first of these sessions took place in Roanoke on December 1st. Another took place in Fairfax the following Saturday, and we've got 5 more scheduled throughout the various geographical regions of the state. And Jennifer mentioned as well, we are hosting a grant workshop and best practices on January 19th and the 20th respectively, and opening the grants application process on that day. And that will be open through May 5th. So that grant workshop is actually going to coincide with VACO and VML's local government day. And our executive director, Tony McDowell, will provide a keynote presentation at the event. And in the afternoon from 1 to 4:30 p.m., the OA will host a grants workshop again for all the cities and counties that would like to attend. That's going to take place here in Richmond at the Omni Hotel. It's expected the first round of awards after that application process is opened in mid-January will be made pretty quickly, hopefully tentative date of March 1st. Hopefully that's not too ambitious, but that's kind of what we're looking at right now. And again, I'd like to highlight a couple of sources of information that I'd mentioned before. Again, the OAG has provided a summary of key provisions on the use of settlement funds. And the APA has provided a very helpful document to assist localities in financial reporting compliance and properly accounting for your local direct settlement shares. And both of these documents are available on the OAA website at oaa.virginia.gov. And you can just click on the media tab and scroll down and you'll see those. And I think they've been posted so recently that they're probably just on the homepage as well. But again, I encourage you to reference those documents. And one of the APA documents is actually a drop-down tool. You can put in drop-down, go to your locality, and it'll actually provide you with the your amount of direct settlement shares, and then some examples, kind of explanatory detail about how to treat those funds from a GASB standpoint after having conferred with other states and GASB officials a few weeks ago, right? So very important information I encourage you to check out. And I think that's it, Jennifer. That concludes my presentation. So again, I'd be happy to answer any questions you all have. I know there've got to be some out there.
They're coming in. Here's one. Would police salaries be considered an abatement purpose?
Probably not. But to clarify, so if there was police salaries whose mission was 100% of what they're doing could be attributed to opioid abatement or remediation, which is probably a heavy lift. That's probably hard to come by. Then that could potentially be a qualified use. I would think in the law enforcement realm, I think it's going to be more about education, about prevention and treatment related to opioid use, opioid use disorder, overdose deaths, naloxone administration, things of that nature. I think are probably more qualified uses, if that makes sense.
Would you advise accounting for these funds in a separate fund?
Yes, absolutely. I think it's important to segregate the funds because you're going to have to account for how they were spent, not only the OA's distribution, but it's kind of unclear. I mean, there could come a point where the defendants petition the court to review how the funds were expended, not only those. So if there, it is, I mentioned that it's kind of a self-reporting mechanism, but yes, in short, I would segregate the funds and make sure that they're used specifically for abatement or remediation.
Okay. Will there be a template agreement forthcoming for opting into the gold standard incentive?
That is the idea. Yes, there should be a template for opting into the incentive and potentially for board approval for whatever projects would be reflected in an application you make to the OAA for use of funds. It's still being kind of that process is still being refined, but yes, that should be the case.
All right. Have the localities been informed about the amount they've received and the timing? Regarding timing, you mentioned the settlement will be paid out over many years. So the amount per year and whether that will be level or follow the pattern on the graph with a spike in FY23 and the lower funding in subsequent years?
That's a really good question. So yes, right. We're going to get, we've just created a finance committee and we're still working out exactly how we want to account for on the appropriation side, on the budget side, relative to the revenue side, right? To potentially, at least with respect to the discretionary funds and not the entitlement funds that would come from the OAA, that 15% that would come from us, kind of a smoothing process, so you don't get these wild swings in appropriation matching those revenues that may be front loaded, 5 years worth or whatever it may be, or Walmart paying $60 million in the first year and then nothing for another 10 years, or for example. We're still contemplating that, but I think whatever the 15% that's entitled would probably run alongside the revenues that are received on an annual basis, and then those discretionary funds may be smoothed out, but we're still, again, in the process. We would need to consult our board and figure out exactly how we want to approach that from a long-term financial planning and budget approach. But that's a really good question. We will, to some degree, try to mitigate those wild swings, and we do have a statutory mandate to actually think about long-term funding, which is we've kind of interpreted as doing that, right? Managing these funds over the long term rather than just reflecting a huge slug of money up front and then trying to spend it all in that year or the subsequent year. All
right. I have two questions here that are related. To clarify, towns within the Commonwealth are not eligible to receive funding. And then should a county apply separately for a town or include in one application?
So I missed the first and which first entity. So again, I think I can cover with this answer though. So only cities and counties can receive funds, and the state, right? But with respect to localities, you could make an application and have the town be a subrecipient of those funds. And you may want to describe that. It wouldn't count as a regional project because they aren't technically a participating subdivision. But again, a town could be a subrecipient, as could a non-governmental entity or even a private service provider be a subrecipient of funds, but you just have to oversee the work. So if you were to extend money to a town, you would make the application on behalf of the county, right? Town would be a subrecipient, and then you would be responsible for monitoring the work performed by the town, even if it's a portion, right? If it's a portion of whatever you're proposing for grant funding.
Okay, thank you. Do Narcan classes and providing Narcan for the public qualify?
Yes, I believe so. I think that would work.
Could you use money towards coordinator salary for recovery programs?
Yes, I think again, it depends on, and we're still working out the fine details around this, but it would depend on the percentage of work being performed by that person specifically related to opioid use.
Okay, so this person wants to be sure the application will open around January 20th and make awards on a rolling basis starting on March 1st. With the application period closing May 5th. Question, so if so, is it safe to say that if equally strong proposals were submitted on February 1st and May 1st, the application submitted February 1st would have a better chance of funding?
Oh, yeah, that's a good question. I mean, they're going to be considered as they go in. So again, I think there's going to be essentially two. Hopefully this answers your question. I think I understand what you're getting at. There's kind of two standards almost for the OA funds between the entitlement funds at 15% and the discretionary funds. Technically, the regional projects are opening up. I don't know how many regional submissions we intend to receive or anticipate receiving early on, and I'm sure we'll get some. But essentially, with the entitlement funds, as long as you demonstrate that they're going to be used for an approved abatement purpose, and then you have some performance measures associated with them, and then again you agree to the other terms associated with the OAA, those are going to be distributed to you, right? So it comes in January, it comes in March, comes in May 1st. Those funds are going to go out to you. They're not going to be reallocated. And then in terms of timing, we'll have to consider timing for the allocation of funds related to the discretionary awards, right? So well, the mechanics of that we're just going to have to work out. But I see your point. If there's a huge number of applications early on and someone submits something very late, it could be the case that if those were all qualified uses, that funding isn't available. But I will say that we're doing it to account for new settlements that are coming on, and changes happening late in the year during a fiscal year. We envision a process where you're essentially for budgeting on a 2-year basis, right? So in FY23, we would be doing 23. If settlement funds come in late in the current fiscal year, you could amend 23, and then also you would have a budget for FY24 where you could reflect those revenues that you might otherwise not be able to expend in the current fiscal year, that sort of thing. So there's going to be a process. You almost have like an 18-month runway or so, like when you're planning on a biennial basis, right?
Hey,
so
Adam,
yeah,
can I add a little on top of that?
yes, sir.
Hi, everybody. My name is Charlie Linticum. I'm the Director of Operations for the Opioid Abatement Authority. So the biggest thing to think about for your 15% that's available through the OAA for you as a locality is that's not competitive. I guess it could be considered competitive based on how many projects within the locality wants to determine to submit up to the amount that they have available for the funding time frame. Whereas the regional projects are more competitive in the fact that there is a limited amount of money that we have to be able to distribute to those. And there's also guidance in the statute that says we have to kind of get them to be equitably distributed across the state. We can't put all the money into, just Northern Virginia or something like that. So the grants committee and the board have to kind of weigh those things. So so there is a potential, I think, with regional projects that something coming in sooner maybe could get funded. We haven't quite determined how we're going to do that, if we're going to hold them all and wait for the period to close. But we know if some of the localities are deciding to say, we want to take our 15% from the OAA and put that towards a regional project, then that could affect, and if that regional project for some reason wasn't approved, that could cause problems for them being able to use their money. So we're trying to make it as flexible as possible. And it's kind of like we're finding different questions and different things each day. And so we're modifying it to try to make it as flexible as possible for everybody.
Thank you, Adam.
Yeah, thanks,
you,
Charlie.
Charlie.
Appreciate it.
So Charlie, maybe you can add in on this one too. If locality is entering into an MOU with a neighboring locality for a regional impact, did you say that we could potentially be eligible for additional funds since 2 or more localities are working together towards a regional project?
Right. So one of the things that is going to be part of the application is going to be like a budget matrix, and it's going to kind of show the different ways that a program can be funded with, the direct funds, the 30% that the localities are getting, with the 15% from the OAA, with, general funds or federal grants or things like that. But then, yeah, honestly, if you have 2 localities that want to do a regional project, they could, put their own monies into it and also potentially apply for the money out of that 35% regional bucket as well. So, yes.
So like doubling up, almost stacking. Is that what you're saying?
Yes. Do you agree, Adam?
Sure. Yeah. Yeah, no, I think you're right. Yep. That's my understanding.
Okay. Here's another question. Can you clarify about how we should be applying for the funds? The questioner works for a CSB, wanted to know if they could apply for funding on behalf of the locality, or do they need the locality to apply for part of that they're awarded? The
locality would need to apply. I mean, Charlie can expand on that.
The localities are the only people that can apply. They can enter into an MOU with the CSB, or for the CSB to be like a subrecipient to actually run the program that they want to do. But the applicant has to be the locality, and then the ultimate fiscal agent is the locality, and then anything else from everyone else is basically a subrecipient in some way or form that you need some type of formal agreement with.
That's great. What period of performance do you anticipate for these OAA awards? Annual reapplications or long-term awards?
We're planning on kind of, I think as Adam talked about a little earlier, kind of 2 years, which is, for this first year, obviously it's all new, but it would be, if we're able to get your application approved and get you some money on the back end of fiscal year 23, that would be the first year. And then fiscal year 24 would be the second year. And then from there, we would do an annual renewal where you could always amend so in late 2023, you could amend your fiscal 24 and then apply for fiscal 25. So we'll kind of be on that rolling to give you, we want to be able to, again, to be flexible and give you all the opportunity to deal with unforeseen things or, additional settlements that may come in that may give you more money to work with within a particular year than you may have known, 6 months or so prior. We are hoping after we do this initial period of awards to kind of have like an October to January, February as our normal open period to more coincide with when localities are developing their budgets and that type of thing. So.
Thank you. Existing abatement programs and services be eligible?
Yes. Should be. Would need to make sure that they have kind of met all the items that are in our standards with performance measures and those types of things. But yes, if the kicker with the 15% is, Adam talked about supplanting. So with the OAA funding, you can't take away local general funds that may be used for that program and replace them with OAA funds. But if you want to expand that program, and add, more resources to it, then that would be something that would likely qualify.
Great. This is the last question I have from the chat, and then I'll up to the floor. Will there be a virtual option for the January 19th and 20th workshops?
Don't know. My gut would be there's going to be a lot of people in the room, so I wouldn't think so. But I would have to check with VACO VML. I don't know if they were planning to do that. Since they are hosting that, we are just humble presenters trying to help everyone out. So we'll have to find that out, and we can follow up with that information.
Great, thank you. And now I'll open up to the floor if there are any questions out there.
Hi, this is Alicia from Arlington County. Could you clarify on the grant period that opens in January 20th? Is that expected to be only used in FY23, or is that also for FY24, or is it to start in FY23 and we can carry over to 24? Could you talk more about the timing there?
Yes. So I think the idea is that you could have money in both 23 and 24. If you have an application in a time frame where you can, we usually we're going to expect to need at least 30 days or so once an application comes in to get it processed, because we have to do our reviews, do any follow-up questions that we might have with the applicant, and then it has to go before our grants committee to be approved, and they're meeting about once a month throughout the period. So we're hoping we can put things forward in like kind of a block approval. But the kicker is obviously timing. If you get the approval in time and you have the appropriation that the board can award, and you can get some expenditures out, you can do stuff in 23. I think this year is obviously the oddball. So I'd leave it to you all to determine if you want to try to do that or just push everything to start in FY24. But we are working on an amendment, like an ad hoc amendment process. If something needs to change within the approved programs, and then also when you would submit for amending 24 and asking for 25, if you had funds from 23 that you wanted to carry into 24, that would be an opportunity to ask for that.
Okay, and also just to clarify, I think I was more thinking of the non-competitive portion. And so I think if I heard you right, we can apply starting January for the FY23 non-competitive award, and in our application state that we'll probably be starting, the program in FY24. It's not necessarily starting in FY23. We're just applying.
Right. So yeah. When it opens up in 23, you have the option to put funds into FY23 if you want, but
Okay.
It would be an application for FY23 and FY24 together. But if you don't think that timing wise that you're going to be able to execute anything in 23 and you just want to put everything into 24, that's fine as well.
Okay. Thank you.
Mm-hmm.
Are there any other questions from the floor? Okay. Oh, reimbursement basis. Somebody says
No.
reimbursement basis.
No, we would be awarding the funds to you that you are due for the time period of the grant. We're not doing a reimbursement process on this one.
Okay. Looks like that does it for questions. Adam, Charlie? Oh, wait, hang on. One more came in. Predictability of ongoing funding, i.e. level per year versus spikes and dips, will be critical to understand whether funds will be available to completely fund expanded programming and how for many years.
Yes, I think that's accurate, and that's why we're contemplating. So it's specific to the settlement agreements and settlement terms about how the funding comes in. Sometimes it's front loaded, sometimes it specifies that it's equal amounts over 15 years, for example, right? So that's why we're contemplating a again consistent with kind of our statutory mandate, ensuring that there is funding available in the out years rather than just budgeting level with the revenues as they come in on an annual basis. So it is anticipated that you will have some there will be some reliability around the funding that's available on an annual basis for a number of years, and then that will be revised again as new settlements come in. But then at that point in time, probably if it's a multi-year, depending on how much comes in that year, spread out from that point on, right? So we're trying to budget for to account for that, right? So you're not seeing this wild volatility with these huge slugs of money coming in and then there's nothing available 5 years from now, for example.
All right. Here's one. Should we be adding interest on expended balances? Should we be adding interest on expended balances?
Adding interest on unexpended,
sorry.
unexpended makes more sense. Yeah, unexpended balances, adding interest on. I don't think there's an arbitrage provision. You may have to reference. I don't think there's anything in statute. I think that's what you're referring to, right? No arbitrage restrictions on fund use. I know that the OAA is able to invest the OA's funds and earn a return on that money. So I suspect that your direct settlement shares are probably okay to earn interest as well. If that's the question, I think that's what it is. You probably would want to have your county attorney, someone look at the settlement agreements to make sure. I don't think that there's a restriction on that.
Okay, one more. Funding will roll over from fiscal year to fiscal year if specific yearly allocations are not fully spent? Question mark.
Yes.
So I think there would be a process when you renew to ask to carry forward, what was unexpended. I think we're trying to, I think one of the things we're trying to do is not be a barrier, but be like a guardrail and a speed bump to make sure everything's going the right way. And I think the board may have to decide if there's growing balances that are being unexpended, whether or not that would be something that should be carried over or should be like debited from a next payment, which pushes your money availability out a little longer. And what does that look like? So that will probably be something that will be a bit of a case by case basis as to how it would be, handled. But we do plan to have a provision in our budgeting matrix that would be submitted every year to identify unexpended funds from the previous fiscal year and to ask, to request what you would want to do with them.
Got it. Can funding be used in collaboration with other agencies and for contractors who can oversee the administration of a program?
So, yes, just remember that the locality is ultimately responsible for what happens. And make sure that agreements are in place with any contractors that are being used. And certainly if you have if there's other organizations that want to put funding towards this program to help it be successful, that's wonderful, be it, something philanthropic or, another kind of semi-government entity that's doing part of this. It just all needs to be kind of spelled out in the application and make sure that there's clear lines where everything's are. But the locality is the fiscal agent. The locality is ultimately responsible for what happens and ensuring that they have proper subrecipient monitoring for anybody that's getting paid that things are actually being used for those abatement purposes.
All right, thank you.
Mhm.
Last call for questions. Oh, now they're coming in. Could funding be used to develop a drug court docket and supportive services to reduce the necessity for incarceration?
I think yes,
I think so. Yeah.
that's under justice involved type of things.
Mhm.
All right. For the direct money, is there an approval process, or is the locality does the locality just need to, oh, now it moved. Locality just need to spend based on OAA standards?
Do you want this, are you, with respect to the direct settlement shares, we don't technically have purview over those. So you would need to spend them at least in accordance with what's stipulated in the settlement agreement. However, if you were to adopt the OAA standards, again, the gold standard, and receive the 25% incentive on the on your OA funds, then you would need to follow the 100% abatement purposes, right? And then no indirect cost, no supplanting, and so forth.
So, and there's not really an approval for that after you've,
Right.
opted in, but as part of the application process, you'll need to be reporting to us what you are using those funds for, so that we have a record to know that they are being spent on abatement items.
All right. Could funding be used for a 23-hour crisis receiving center?
Potentially, I think we would need to know kind of, is it just an opioid focused crisis receiving center? If it's got a broader mission, then is there an estimated portion that is kind of opioid use, and that a funding model can be set up based on that? It's definitely not a no, but it's one of those that we need to really understand what the model is to be able to understand whether or not it can meet all the funding, because it's one of the things that happen. We know there is language that talks about like co-occurring issues and things. It's not that everything has to be blindly specifically opioid, but there's also places where things can kind of grow awry, and as Adam has hinted at a couple of times, we want to be able to report out brightly that we're using things that are opioid related, that meet the terms of the settlements, the MOU, and the statute, so that if anyone wants to come back, we can show no, we've got all this stuff well covered. So
Okay. That was the last question that was in chat. Well, thank you everyone for participating in today's session.